When handling all instruments, safety and economy of movement is essential. Relaxed handling is needed in order to avoid awkward movements at the tips of the fingers. When opening a suture package, tear it open as shown and remove the needle from the packet with the needle holder. Never use your fingers. Never pick up needles with your hands. It is important not to handle sharps directly like this. When picking up needles, use the needle holder, and then if you wish to alter the position of the needle in the needle holder, don't use your fingers, use the forceps to hold the needle and reposition it. Also be careful when tightening sutures that the needle does not do damage outside your field of vision. Therefore, when dealing with a long thread, don't simply pull at the needle, but use the middle finger of your right hand to grasp the thread, and then use your closed forceps to take up further slack. Suture material can then be tightened without the needle leaving your field of vision. Your suture material is then passed to your assistant, and the needle is now available for your next suture. When you have finished with the needle, do not lay it down on the patient or on the table, but pick it up and whenever possible dispose of it by cutting off the thread and placing it in the sharps bin provided. Never handle a blade with your fingers, but always use a hemostat as seen here. Slide the blade gently onto the handle. When it comes to removing it, just lift it off from the distal end and slide it off gently without jerking. Immediately place it in the sharps bin that is provided. Remember, when operating, do not have the table set too high or for your back's sake too low. The most comfortable position to operate in is one where your forearm is resting horizontally. Safe and effective surgery requires correct and safe handling of all surgical instruments and sutures. Please take time to acquaint yourself with the instruments provided. Let's first of all look at the scalpel. When handling the scalpel, you do not handle it like this or like this, as you don't intend to stab anyone. Instead, handle it in this manner, using your index finger to steady it. Then you can draw it gently and carefully across the skin, as you see here, in a controlled manner. Never ever cut towards your own fingers or thumb, as it may not just be the patient that you cut. When doing delicate work with a fine-bladed scalpel, you may wish to hold it like a pen. Then finer work can be undertaken. Note how the little finger can be used to steady the hand holding the scalpel. When passing a scalpel, never pass it blade first, but handle first with the blade down. However, the safest way is always to put it into a kidney dish and pass it to your assistant or scrub nurse. Now, let's look at the scissors. There are two types of scissors. One is more robust for cutting suture materials, and the other is finer for tissue dissection. Let's look at how to hold scissors. Hold them with just the tips of the distal phalanges, with thumb and ring finger in the rings, steadying the scissors with the index finger and the middle finger. Never put your fingers right the way through, as this makes it difficult to extract your fingers from the instrument. However, by using